Hi, I'm Angela Plowhead, and I'd like to welcome Paul Evans, incumbent Democratic candidate for House District 20.
Thank you for allowing me to be here. I'm looking forward to it.
Absolutely, we're glad to have you. So tell us about the votes you cast last session that directly benefited seniors and people with disabilities.
So what I'd like to say before I begin talking specifically about legislation is that this last session we actually weren't able to take votes that made an impact because our colleagues on the other side decided to walk out. And the things I've been able to accomplish and support really come from the 2019 session. When it comes to seniors, House Bill 2524, House Bill 3413. When it comes to people with disabilities, Senate Bill 493, 491, Senate Bill 19. We put $30 million in general fund to provide greater support for mandatory reporting of abuse. We've tried to move the ball forward, but it takes everybody working together in common cause. And unfortunately, in 2020, our colleagues on the other side decided that it was more important to make a political statement than actually meet the needs of seniors and those with disabilities.
All right. Oregon Project Independence is a program that keeps seniors and people with disabilities in their homes. Yet every year, proposed funding for OPI is significantly cut. If re-elected, how will you ensure funding continues for this cost-effective program, especially during anticipated budget shortfalls?
So Oregon Project Independence is one of those win-win environments. It is a good piece of legislation every time we've invested in it. And as a legislator in the last 3 terms, I've worked on investing in it, I think, twice, expanding it. It is one of those programs that needs to be taken care of. However, we are facing, because of COVID, a very big budget deficit in the coming year. And we're going to have to either make some very hard choices or become more creative about finding revenues to support our needs. And I think that the voters will recognize that there's a fundamental difference over my 6 years as a record in how I approach problems than with my current challenger. I don't promise things that I'm not willing to go fight for funding for. And Project Independence is one of those things that I will continue to fight for.
How would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to increasing seniors and for services to an increasing senior and people with disabilities population?
Again, over the last 3 terms, I've worked very hard to optimize every federal match opportunity possible. Through something called the provider tax, we've expanded the scale and scope of healthcare for those at risk and seniors. We have worked on housing issues that are related to the well-being of both groups. I will continue to prioritize what I like to call force enablers, those policies that unlock potential in other related areas. And I think it's critical that we look at healthcare, that we look at housing, that we look at transportation so that people can get to and from work, to and from medical care, to and from grocery stores. It's all interlinked. And the fundamental problem is we've been rearranging the deck chairs on a sinking ship. Our tax structure is really not robust enough to meet the needs of the 21st century. And as the wealth gap grows, we have to become even more creative, more innovative, and I think, quite frankly, a little more passionate about fighting for the values that make Oregon, Oregon.
During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face a lack of accessible and affordable housing and receive appropriate nutrition?
So again, this particular question focuses on the interlinking between housing and food supply. I would actually add transportation, healthcare to round it out. I will continue looking for ways in which we can help local communities identify areas that they can improve. When it comes to housing, unfortunately, the way the market works, there's no one solution, no cookie cutter approach. That said, I've worked on legislation that would provide incentives for building smaller houses. I'm working through the Emergency Preparedness and Veterans Committee on priorities that would produce more power and actually help in terms of infrastructure and transportation that might have a force enabler effect on development in communities. I've worked on trying to make sure that transit is much more available. I was a leader in pushing the Salem-Kaiser Transit Board to change its governance so it could actually get more assistance, which means more routes, which means more opportunity for people to actually access places that their housing was unfortunately not located nearby when it was built. We have to approach it with a systemic mindset. And unfortunately, in today's politics, too many candidates will promise this one thing or that one thing without understanding that you have to approach a particular problem with a series of tools. You have to have a strategy that actually is integrated, and you have to actually recognize that some things cost money. As a Democrat, I don't believe we should tax just for the sake of taxing. On the other hand, with the greatest wealth disparity in American history, at least since the turn of the century, 1890s to 1900s, we have to get smarter and better about providing social services, and I committed to do that.
What are your plans to improve the health of vulnerable seniors and people with disabilities, including people of color who traditionally suffer from more health disparities due to pre-existing conditions?
Well, my plan is to continue building on what I've done in the past, supporting every single expansion of Medicare, Medicaid. Again, integrating transportation so that people can get to and from their appointments, putting money behind telehealth, making sure that pharmacies are more fair in terms of the pricing. We've taken some moderate steps on that. Working with insurance companies so we don't have the wrong priorities for keeping people healthy. Part of the plan has to be immediate care of those that are in the most need, but also a strategic prevention strategy so that we actually keep people healthier for longer. That has to be a part of the equation as well. One of the things I've done as chair of the Veterans Committee is I've recognized that if we focus on trying to get veterans, which are about 1 out of every 11 citizens in Oregon, if we get veterans from the Oregon Health Plan into the Veterans Administration, it frees up space for more people on the Oregon Health Plan. If we get veterans into veterans housing and veterans home care facilities, it actually frees up space for other people because that's all federal money. So in a combination of trying to leverage every single federal dollar, treat our veterans with dignity, respect, and the services that they deserve, and fighting for more funding for the entire population, I think I have a pretty good record on how I plan on doing what we've been doing over the past 6 years.
Mr. Evans, thank you for joining us today.
Thank you. It's been a great pleasure. I look forward to working with your organization as we move forward. And hopefully everybody can enjoy this program without too much the sunshine and heat getting in the way.
Thanks again to Paul Evans, candidate for House District 20, and thank you for joining us.